vestibulum oris. It is cavitas oris propria, superior wall that is palate, hard and soft. And what is inferior wall of cavitas oris propria? Tell me, please. Inferior wall. That is diaphragm of mouth, that is diaphragma oris, and which muscle is main muscle of diaphragma oris? Musculus mylohyoid muscle, musculus mylohyoidus, that is main muscle on the floor of the mouth. Now, this is what? What is it? That is tongue. That is tongue. Here it is the same. This is tongue. That is which part of tongue? Apex, yes, tip. Apex, apex linguae. Then here it is root of the tongue, radix linguae, and between apex and root, that is a body. Superior dorsal surface, that is dorsum linguae, and inferiorly, that is place where mucous membrane from diaphragma oris continues to tongue. It is on midline, we can see frenulum linguae, frenulum. That is continuation of mucous membrane from tongue to inferior wall of oral cavity. You can see that posterior third in the region of root of the tongue, here it is mucous membrane makes lingual tonsil, tonsil lingualis. Anterior two thirds of the tongue has a lot of papilla. Some of them papilla of taste, another papilla of general sensivity. What is general sensivity? What is it? Touch. What? Temperature and pain. That is papilla filiformis and conica. Impossible to see. They are very small papilla. Only under the microscope we can see them. Papilla filiformis and conica. And taste papilla, largest taste papilla, they are papilla vallata, vallate papilla. They looks like letter V. Look here. This is papilla vallata, and here it is, and here, and this, and this V shape. That is largest papilla of the tongue. Here and here. Laterally, on lateral side of the tongue, we have. It is papilla foliata, foliate papilla, like pages of the book. If you see here, this is papilla foliata here laterally, and on this side the same papilla foliata we have, and papilla fungiformis on the dorsal surface of the tongue. We have a lot of small papilla fungiformis. Now, some words about muscles of the tongue. In your textbook, present two classification of muscles. First classification, that is, they are extrinsic and intrinsic muscles. Intrinsic, inside of tongue, they are vertical muscle, transverse muscle of the tongue, and two longitudinal, superior and inferior muscle. And other muscles, extrinsic, they start from bones. For example, from mandible, we have genioglossus muscle. From hyoid bone, hyoglossus. From palatine bone, palatoglossal muscle, styloglossal, they are extrinsic muscles. Another classification, we have three visceral arches, first, second, and third. First visceral arch, that is visceral arch from which mandible develops. That is, first group of muscles which start from mandible, from derivates of first visceral arch. They are musculus genioglossus and vertical muscle. From second visceral arch start muscles longitudinal, superior, inferior, and styloglossal muscle. And from third visceral arch, hyoglossal and transverse muscle, that is the continuation of musculus palatoglossus. These two classifications you need to know next time. Some words about teeth. It is different teeth. they differ one from another with the shape of crown. Each tooth consists of crown, that is upper part, above of gingiva. This is, what is it? Root, radix dentist. And between crown and root, we have neck, column dentist. And teeth differ one from another with the shape of crown and with the number of roots. For example, what is the name of this tooth? No, this is incisor. This conical shape in canine tooth. This is premolar and here it is molar. Differences. Sharp anterior surface in incisors and conical shape in canine dents, and both of them has one root. Premolars has two tubercles, anterior and posterior tubercle in crown, usually one root, but sometimes maybe two roots. In most cases it is on the second upper molar, two roots. And premolar, molars has four tubercles, 1, 2, 3, 4, usually two roots and sometimes maybe three roots. You need to know formula of permanent teeth and formula of milk teeth. Yes. Permanent teeth, 2, 1, 2, 3, 2 incisors, 1 canine, 2 premolars, and 3 molars. Milk teeth, 2, 1, 0, 2, 2 incisors, 1 canine, absent premolars, and 2 molars. And total number of milk dams? 20, and permanent? 32. Good. What is the name of connective tissue between tooth and alveolar dentalis? What is the name of connective tissue which fixed tooth in alveolar? Oh, gymphosis, that is a type of syndesmosis. But name of connective tissue which fixed tooth, that is periodontium. That is connective tissue between root of the tooth and alveolar dentalis. And type of articulation, that is gymphosis. We already said which salivary gland opens into the vestibule. One again, parotid gland. Another two glands, submandibular and sublingual, they opens into cavitas oris propria. In which place? Two ducts of submandibular and sublingual glands join together and opens where opening of sublingual duct and submandibular. Where? Caruncula sublingualis. Sublingual caruncula. That, where is it? Below of tongue we have sublingual fold, plica sublingualis, and on the apex of this fold we have small opening, that is caruncula sublingualis, where two ducts opens. Now, oral cavity posteriorly continues into the pharynx. And what is the name of opening between oral cavity and pharynx? What is the name of opening here? That is oropharyngeal what? Isthmus or fauces. Oropharyngeal isthmus or fauces. Can you give me textbook? No, he is absent. Well, look here. This is soft palate. Here it is tongue. This is palatoglossal muscle, and together with mucous membrane, it makes arch, arcus palatoglossus. And this opening between soft palate superiorly, tongue inferiorly, and arcus palatoglossus laterally, this is oropharyngeal isthmus or fauces. And this fauces that is opening between oral cavity and pharynx. And here it is, look here, this is oral cavity, here it is fauces, and that is pharynx, oral part of pharynx. And maybe you know that pharynx consists of nasal part, oral part, and laryngeal part. Nasal part because, why it has a name, why this part of pharynx has name nasal? Because in front, nasal cavity. And what is the name of opening between nasal cavity and pharynx? Who can answer? What is the name of this opening here? And Juan, yes, Juan. That is Juan, between nasal cavity and pharynx. And between oral cavity and pharynx, fauces. And in front from laryngeal part of pharynx anteriorly, this is larynx. Look here, this is larynx, and behind of larynx we have laryngeal part of pharynx. That is why 3 departments: nasal, oral, and laryngeal. Nasal part of pharynx, it starts from the base of the skull. If you remember, this is, what is this part of occipital bone? Help me, pars basilaris. And pars basilaris of occipital bone has tubercle. Who remember? Pharyngeal tubercle, tuberculum pharyngeum. From this tubercle, at this tubercle attach fascia pharyngobasilaris, that is base of the pharynx, that is fascia which is inside of pharynx, and it starts from this tubercle, from tuberculum pharyngeum. That is why pharynx, it starts from the base of the skull, and nasal part of pharynx descend to the level of second cervical vertebra. Oral part of pharynx is opposite to third cervical vertebra. And laryngeal part, it starts from the level of fourth and descend to the level of sixth cervical vertebra. That is topography, topography of pharynx. Now, pharynx has 2 types of muscles. Some of them circular muscles, circular, another longitudinal. Here it is. Circular muscles, they are constrictors: musculus constrictor pharyngis superior, musculus constrictor pharyngis medius, and musculus constrictor pharyngis inferior. 3 constrictors: superior, medius, and inferior. And 2 longitudinal muscles: musculus stylopharyngeus, between stylate process and pharynx, stylopharyngeal muscle, and another muscle is musculus palatopharyngeus, from palate attached to pharynx. Palatopharyngeal and stylopharyngeal, they are longitudinal muscles of pharynx. And pharynx then continues into esophagus. And we discuss esophagus after the break. Okay? Time for break now. Take the places.